Welcome to INP4. We're still on the pain management of the perioperative client unit. Just want to take a look at a sample from 2019, epidural coagulation protocol. At some point, and you can find the most recent ones on SHOP by yourself, but this one is on your Moodle shell already. It might be a little old, I'd have to check, but nonetheless, the principles is what we want to talk about here. At some point in the set orders or in the written orders, there will be, the epidural will need to be removed. That's RN scope to remove the epidural. However, you might be caring for that patient, very good chance that you could be caring for that patient, and you're giving the meds. And they also have an anticoagulant due today. So how do these two things come together? First of all, let's talk about what we don't want to have happen. We don't want to have the anticoagulant given too close to the time that the epidural catheter is removed. Why is that? That could cause bleeding, hematoma around the epidural area, and that puts pressure, compression on the spinal nerves, and that could cause some damage. So while we want to avoid it, it's pretty straightforward. What do we do to avoid this happening? We follow the protocol such as this one. Okay, so just skipping right down to the chase here. This is generally what we want to look at right here. These bullet points right here. This is what you definitely want to keep in mind before you give those anticoagulant drugs to your patient. So you can read through this. It says that the epidural catheter should not be removed within 12 hours of this med or within 6 hours of this med. So if by lack of communication or lack of coordination, you ended up giving the dalteparin, the RN would have to wait 12 hours for it to wear off before pulling out the epidural catheter. This is not an ideal situation. That's what you'd have to do if you give an injection before the epidural was removed, but it's not ideal. Surgeons do not like coming around in the morning, writing an order, and then coming around near the end of the day, say 7 hours later, and now to do pain services, by the way, and seeing the epidural still in. That slows down patient discharge, that everything. They need to get that out. They're gonna be, why wasn't this taken out? Well, sorry, we didn't communicate very well, and I gave the dalteparin before I knew that the RN had to take this out. So how do you avoid this? This is the worst case scenario. These two here, one's for the dalteparin. This is the worst case scenario. This one's for the dalteparin. This one's for the heparin. You'd have to wait 12 hours after you gave the dalteparin. You'd have to wait 6 hours after you gave the heparin. That's not an ideal situation. But that being said, it's better than taking the epidural catheter out too soon. The best situation is to communicate with the RN, to both be checking the orders and to know and to coordinate your activities so that the RN takes out the epidural, and then 4 hours later, you can give the dalteparin, or 1 hour later, you can give the heparin. Much more efficient and much safer, and keeps with what the orders have asked for.